in Trinidad and Tobago. I will be your moderator for today's session. So this session is one in a series of webinars being hosted by the PAHO WHO Country Office in Trinidad and Tobago, and I'm pleased that you can join us this afternoon. This is a collaboration with the Ministry of Health Mental Health Unit, Trinidad and Tobago, as part of the implementation of the National Mental Health and Psychosocial Support Plan. The emphasis of today's webinar is on caring for the carers, managing your own mental health while caring for others. We have had sessions on self-care for healthcare workers, COVID-19 and the school environment, and coping with the stresses of COVID-19 for young people and their parents. But we know caring for someone can be a stressful experience, whether it's in a formal role as part of your job or as a parent taking care of children and other loved ones. Caregiving can have negative impacts on the physical and psychological health of caregivers due to the stress that comes with that responsibility in general, but especially during this COVID-19 pandemic. So, who is really caring for the carers? Do we as caregivers ever stop to think about ourselves? So we at PAHO and the Ministry of Health thought it was important to have this session today to speak directly to you as caregivers, to remind you of the need to think about yourself and to manage your own mental health while caring for others. So today, we have two speakers that will share with us some tips on how we can care for ourselves. But before we go into the presentation, I would like to hand over to Dr. Erica Wheeler, our PAHO WHO representative for Trinidad and Tobago and the Dutch Caribbean Islands, to say a few words. Over to you, Dr. Wheeler. Dr. Wheeler, your mic is muted.
We're not hearing you, Dr. Wheeler.
Still not hearing Dr. Wheeler. So in the meantime, while we work on getting Dr. Wheeler's mic to operate, I will just look at a few housekeeping rules. So before we go into the presentation, I just want to remind you that your mics are muted. So if you have any question as the presentation progresses, I encourage you to submit these in the chat and we will address them at the end of the presentation in the Q&A.
Hello, Caroline, can you hear me now?
Yes, Dr. Wheeler.
Okay, all right. Aubrey fixed it. Thank you.
Okay.
Well, you go ahead and finish your housekeeping and then I'll speak.
Right. So the second housekeeping is that the presentation will take the two presentation, and then at the end in the Q&A, we'll take all the question. And the webinar is being recorded and we will upload these to the PAHO website. So I'll hand over to Dr. Wheeler for her to give her remarks. Over to you, Dr. Wheeler.
Thank you, Dr. Malcolm. You can hear me now, right?
I can hear you clearly.
Okay, wonderful. Okay, so thank you and good afternoon to everyone. Special thanks to our presenters, Dr. Caetano, our Regional Mental Health Advisor, and Dr. Khatija Khan. Thank you so much also to Dr. Hazel Othello, who is going to moderate this session. This is a very important session in the series, as Dr. Malcolm has said, because very often we think of the victims, whether it be in a disaster or any situation like we're in now for COVID-19, but we don't always think about those who care for others. I myself have been in a situation, in a post-disaster situation, so I know how important it is to continually self-monitor my responses and those of my colleagues, to be aware of the kind of stress that I was under and to assist others. And I was actively involved in working to rebuild and strengthen both the knowledge and the competencies of health professionals in a disaster setting. So I am acutely aware of the impact that any situation that calls for you being in a situation where it's not normal, such as the pandemic that we're in. And very clearly, Dr. Malcolm pointed out who are the beneficiaries of this webinar. And it's so good to see we have 60 people on the line who themselves, many of whom I hope are carers. And we want you to know that PAHO really takes this seriously. The fact that you care for others, whether you be a health professional, whether you be someone at home caring for your family, whether you work in a home for children or people who are disabled, we think of the whole spectrum of people who are called carers. We've been under lockdown for a while. And although now in Trinidad and Tobago, we are fortunate in the sense that we are not sheltering in place, as it were, we are still in a situation where we're observing certain public health measures, but it's not something we're used to. We're having to get used to it. It's something that's unfamiliar, and this pandemic was totally unexpected. So although we have partially come out of it, we cannot underplay the effects that it has on the mental health of us as human beings. We're not used to wearing masks in public. We're not used to physically distancing from others. And as you know, I'm sure Dr. Cayetano, being Belizean, we're used to hugging and kissing and, touching each other. And so this is something very unusual for us. And we are having to get used to the new normal. But we have to, because even at this time, when we are no longer under lockdown, our borders are closed. And we know that when our borders reopen, that there is every possibility that we will have cases. So we have to get used to living differently. It doesn't mean that we don't care for each other anymore, and it doesn't mean that we forget about those who care for others. So I'm very happy that we have the kind of support that we do from the ministry, from you, Dr. Cayetano. You're very faithful. You're always with us on all of these webinars, and we hope that you will continue to stay with us. And we're happy to have Dr. Khan on board from UWI, because of course, UWI is an extremely important collaborator and supporter of the work of PAHO at the country level. So I just want to thank you again, and it's going to be very stimulating, I'm sure, and I can check in afterwards and listen to the recording. I'm sure there'll be a lot of questions from the carers on the line. And it is so wonderful, well, we're up to 61 now, that we can do a webinar and have so many more people online than, if we had to do something in person and only get 1 or 2 people from the country. So I think it's a wonderful opportunity, and we're taking advantage of it. So I want to wish you all the best for your discussions, and I look forward to hearing from Caroline, who is always very excited and engaged in her work. And so I look forward to hearing from her. Thank you very much.
Thank you, Dr. Wheeler, for those encouraging remarks and to set the foundation on which we will travel today. Our first presenter is Dr. Claudina Cayetano. Dr. Cayetano is a regional mental health advisor with the Pan American Health Organization, and she's based in Washington, D.C. She is a public health practitioner and a medical doctor specialized in psychiatry. She received her degree at the Universidad de San Carlos in Guatemala, her postgraduate degree in psychiatry at the McGill University in Montreal, and her master's degree in public health from the University of Liverpool in the United Kingdom. Dr. Cayetano will share with us some tips on caring for your own mental health. But before I give the floor over to Dr. Cayetano, I just want to remind you and encourage you that as the presentation progresses to put your question in the chat, because that allows us to have more time for that discussion and answer segment. So the floor is yours, Dr. Caetano.
Thank you, Dr. Malcolm. What a really welcome, warm welcome. And I'm also very pleased that we get the unconditional support from Dr. Wheeler. I think it's always good to know that we can count on her support in making sure that we take time to care for our mental health and on your commitment. So I'm very delighted today to be joined by colleagues from Trinidad, Dr. Khan, to do this. Normally before our presentation, people will say to us, oh, how about the care? What about the care? And so, so this time, I think we're making sure that we have this webinar, particularly for caring for the carer. I think I'll have to switch my screen because you're probably seeing the one with the notes, right? Which is what happened to me last night in one of my.
Yes, I've seen it.
Yeah, so let me stop and then I will move my slide to, okay. So I'll move this PowerPoint, this one. Okay, so maybe it will be best now.
This is all part of the new normal.
I know. Okay. So if I share screen 2, that will be that one. Are you seeing my screen now?
Yes, that's great.
But then you're seeing me looking one side. Oh no. Let me see. God, this happened to me last night. So. Can you see it now?
Not as yet. And as we know that working from home is the new normal. So these are issues that with technology that we can anticipate from time to time, no matter how prepared you are.
Yes, yeah. So but we'll get it done. So that's okay.
Okay, that's good.
That's good now?
So you just need to put in presenter mode.
Is the presenter mode? Maybe I could, okay. Is it okay now?
It's okay. I'm seeing your notes section, but
how do we make it to display? Oh, I know what I will do. So we'll continue.
Yes.
We will continue. What I'm going to do, I am going to change this in slideshow. Okay. I know what I will do that. Don't worry about that. I will start my video.
Yeah.
Then it's easier. Screen 2. Okay. Okay. And then there we go. There we go.
That's good. Yes.
Yes. Okay, great. So my presentation, since I've been introduced, so just to continue because of time, we're going to go and start and talk about what it means to care for yourself. I thought this would be a good opportunity for us to focus on have a clarity, because sometimes when we say mental health, people think of mental disorders, and we want to have the concept clear so that the importance of, everyone has mental health, just like everyone has physical health. That's definitely important. Have the concept very clear. So if we have the concept very clear, it becomes easier for us to know and focus on understanding why it is that we need to protect our mental health. Why, for us as PAHO, we promote mental well-being. So we do that because we know that like a person can have good physical health and at the same time have a physical illness. People can have good mental health and a mental illness at the same time. So having a mental illness doesn't mean that you can't take care of mental health. You still need to take care of your mental health. So to understand mental health, it's important to understand these components and how do we talk about these things. So people talk about mental distress, mental health problems, and mental disorders. So I think it's important that we have clarity in when we talk about mental health, what exactly do we mean? And of course, the relevant here is that we have to think of the importance of our brain. So the functions, our brain have different functions. When you say about thoughts, or thinking, or perception, the brain is, modulator of feelings, gives us signals, things about our somatic feelings, behavior. So everything that a person does, feels, thinks, or experience involves the function of their brain. So most things our brain does depend on, different parts of the brain working together. It's like a network. So the brain, we know, is made of the cells, these connections among the cells and the various neurochemicals. And these neurochemicals provide a means for different parts of the brain to communicate. So this takes me to this pyramid. So in my previous presentations, you probably have seen me presenting a pyramid on the intervention of MHPSS. And think about this pyramid when we say MHPSS. I always explain to people that the bottom of the pyramid is where we all are. Everyone is in that level. So, for example, when we, collaborating with Dr. Malcolm is not she's not a specialized person in mental health. Her role, she's not a psychiatrist or a psychologist. She is our NCD and mental health focal point in the office of Trinidad. But she values the importance of mental health, just like that what Dr. Wheeler was saying. So what we're saying is that in this pyramid, when you look at the bottoms, they know that we all are there. We need to take care of our mental health. So you don't need to be specialized to be able to talk about mental health. That is important to understand. Because if you look at the pyramid here, we're talking, the blue is when people don't have any stress or problem or disorder, but they could still be pensive, they could still be thoughtful. And the second part, we're talking about, when you have some kind of distress. And distress means that, you're feeling unhappy, you're feeling disappointed. It's not a disorder. Remember, this is not an illness. To be sad, to be depressed. Like if we use the word depressed, for example, as a symptom, but then not as an illness. So people can be angry, disgusted, or pessimistic. Then you have another level when things are really happening, like if you have grieving, despairing, demoralized, heartbroken. So you have a mental health problem. We can talk about that. The tip of the pyramid is when you have a disorder. So it could be anxiety, depression, schizophrenia. That is where we speak about the mental health professional. That's because now there's an illness right there. So you see the difference. So we all can have different, we can see ourselves in different levels of the pyramid, but when there is a disorder, that's different. So it's not everyone. So for example, depression is 1 in 4 person that can have a depressive disorder, or prevalence is 25%. So schizophrenia prevalence is 1 in 1,000. So, those are disorders, it's not common, but everyone has to take care of their mental health. So I think it's important that we have that clarity that even if you have become upset or disappointed, that's just a distress that happens to any person. But when the loss of a family member, mourning, people can have, that could be a problem. So here, now we already explained the issue of distress. It's the inner signal of an anxiety, of a stress that a person has when something in their environment is demanding that they have to adapt to is a challenge. So this is what we call a stress. So it's a signal or a response. So a stress response has different components to it. So that has implications in our emotions, implications in our thoughts, implications in our behavior. So that's very important because, the emotions or feelings, the cognitions or thinking, the physical symptoms or behavior. So it has implications that. So as we can see, the stress response can have both negative and positive components. So we need to make sure we don't always focus on the negative part because it has that, sometimes people tend to focus mainly on the negative, but we want to be able to see like there is something positive. This could help us to be able to learn positive things in terms of, coping with stressors. So everybody experiences mental distress. We already know that. So often we call them stress every day. It is part of good mental health. It is a signal that tells us that something new, we need to try something new to solve the challenge we are facing. As the person who feels distress tries to develop solutions or strategies to solve these challenges. So these are often we call them stressors. So we want to figure out what works and what does not work well. Successfully dealing with the stressor or could be, stressor or could be the problem, leads to learning what the strategy worked and use that of strategy in similar situations in the future. So once the person has successfully overcome the challenge, then the stress goes away, but the learning and the skill sets remain ready to be used in another time. This is the process, it's called adaptation or resilience building. So this is very important because sometimes we tell people, remember what you did before that was helpful for you, do that again. So that's because we're working on the resiliency for people. So when we say mental health problems may arise when persons are faced with a major stressor than usual. So this occurs as an expected part of a normal life and these are not mental illness. For example, the death of a loved one, moving to a new country, having serious physical illness, being diagnosed with, COVID, cancer, when faced with this large stressor, everyone experiences strong negative emotions, such as sadness, grief, anger, demoralization. These emotions are also accompanied by substantial difficulties in other domains. So remember we talk about the thinking, of your cognition. For example, nothing will ever, until we start to have this negative thinking, nothing will ever be the same. I don't know if I can go on in my life. And so you have physical symptoms, for example, the problems with sleep, loss of energy, aches and pain. So all these things can tend to exacerbate people's feelings. So mental disorder, again, here we want to be able to capture, when we say a person with a mental disorder, we then experience significant, substantial, persistent challenging in their emotion, their feelings. For example, when someone has depression or panic attacks or anxiety, cognition, their thinking disorders. So this will be much more exacerbated. So the presence of a mental disorder signifies that an individual needs best evidence-based intervention that may be of many different types. So people may require medications, people may require psychotherapy, social intervention, that this is then will be provided by a trained professionals. That's the difference here. While intervention can help the person and to be able to reduce their symptoms. Someone who has a mental illness may require to visit the physician, to take the medication. So that's what's important. So of course here, a mental disorder requires, as I mentioned, that they be treated by a professional that is trained in, that is specialized. So I wanted to present this because if we have clarity on this concept, it becomes easier for us to normalize talking about mental health, to normalize taking care of our mental well-being. So disorders is different. A mental disorder or a mental illness is a medical condition. It's diagnosed by a health professional using international established diagnostic criteria. So it's totally different. So this also has to do, when we talk about mental disorders, we say between a person's genetic makeup, the environment in which they live, that have been exposed to. So for mental health professional, when we're doing a diagnosis, we're thinking of biopsychosocial approach, the biological component, the psychological makeup of the person, and the stressors that they may have. So this is something different, okay? So for me, it's very important that we have that clarity. And again, our human brain, where mental health lives, as we mentioned, or the brain is helping us, planning, self-awareness, judgment, comprehension. All of these are all related to how our brain has to function. So having said that, so we need to move now into what is happening with COVID. I don't think we knew this is something unprecedented. We all know that we have, at least in our lifetime, most of us who are connected to these webinars have never experienced anything like this before. So clearly fear, anxiety, people are really overwhelmed about this, and those strong emotions, whether kids, adult children, very strong emotions. And because of these strong emotions, so you have these changes in terms of sleep or eating patterns, difficulty concentration, and for some people that can also bring them to become worse in their chronic health conditions, either it's mental health condition or physical conditions. And unfortunately, people may tend to start to increase the use of alcohol, tobacco, or other drugs in coping with this. So we are saying that you have stressors, and that then this is how people may be responding to that. So we talk about these psychosocial challenges, changing in work arrangements and conditions, because we want to be able to protect employers, want to be able to protect employee needs to be able to feel safe at the workplace. So there's changes in the arrangements. We cannot all come at the same time. As Dr. Wheeler was saying, we're not used to this, to wearing masks. We like that when we see each other, the minute we see each other, we want to embrace, because that's how we know how do we connect. So, but then that has to change in terms of how we see, how we engage with each other. The essential workers, people are now working from home. Some people are, when it comes to school, not everyone is going back to school. Some must have started school, but there's challenges here. People that have lost their businesses, or people who have had reduced, financial challenges. All of this we consider stressors. So what are the issues that we need to be able to be thinking of? So for healthcare workers and other essential services workers, and I want to be able to identify with that, like we find that our workload has increased. I find that, we have a lot more now to be doing, even though working from home, the demand has become double at times. You have longer working hours, because it's not the same when you're in the office and you can go and see your colleagues and talk this through. Now you need to be, it's by emails, everything is virtual. So you find that your workload has increased if you're still working from home. And if you're back to work, you're back to the office, some other colleagues are not totally back. So still that's the problem. So longer working hours, reduced rest period. And then of course the worries about, getting infected. Like when you meet people on the street, when you're going to the supermarkets, when you're doing your errands, as you feel like you don't know who can transmit the virus to you. Or when you haven't seen family, and then now you're seeing them, you're not so sure who they have been in contact with. So all of those things are worrisome. And then of course, for healthcare workers, if they don't have adequate protective measures in place. For people working from home, you know, that's a challenge, because when you're working from home, the boundaries are not as clear. If you have the children at home, and if the children have disabilities, and like before, you know, kids can go to work, to school, you go to work, you pick them up at the end of the day. That is not, in many homes, that's not the situation. Or if you're caring for an elderly parent or an elderly you know, person that you, before perhaps they were able to go to meet their friends, now they cannot go, you need to keep them at home. And so in addition to that, you have to be able to do your work, you have to be able to take care of them and help with homeworks, and help with, if it's an elderly person, help with their personal hygiene. So this is quite challenging. So the boundaries are sometimes quite blurred. And then, of course, the confinement brings increased risk for domestic violence. People get tense and in tension. Sometimes we don't learn about how do we speak to each other. So that can increase this domestic violence. Fear of losing the job, pay cuts, layoff, and reduced benefits. So because of that, we tend to be, you know, sometimes, you know, that also hinders your concentration. Job insecurity, economic loss, unemployment can have severe impact on your mental health. So this is something to consider. So a question that I have for you, now that we have established the importance of mental health and well-being during COVID, in your role, whether you're a parent, whether you are a co-worker, you're someone taking care of some, you know, in your role, do you think that's important to care for your own mental health, especially during COVID? And I think that Dr. Malcolm will check your responses in terms of when do you think? Do you think this is important, just like taking care of your physical health? The other question, so we call it as part of your active daily living. So your ADL, you know, you wake up in the morning, you brush your teeth, you start to do your personal hygiene, you go maybe prepare some breakfast and get ready to work. So these are we do these things like automatically, you know, those are our active daily living. Do you take time to look after your own well-being as part of your ADL? Is this something that you consistently remember that this is definitely important for you to do? So that there is not a day that, you know, every day you said, okay, this part is 10 minutes is for my own well-being. This is for my own mental health. Do you do that? So I'll give you time to be able to look at your answers, to put your answers in the chat. Now, mental health and well-being. You remember when some of you, I'm sure a lot of you have been on the plane when they announce, the flight attendant will say, before you care for the other person, you have to care for yourself. You put your mask first, right? This is the same thing here. Before you can help others, you need to look after yourself. It's the same way that a car needs fuel to drive. You need to look after yourself and keep your tank full, so you can keep going. Helping in COVID, in the COVID-19 response, is a long distance. We're saying it's a long distance race. It's not a sprint. So pay attention daily to your well-being. So this is important for all of us, okay, that if we want to keep our tank full, we need to make sure that we take care of our mental health, mental well-being. Because if we don't, in the long term, if we don't do that, it will cause more problems. It will affect our sleep. It will, you know, have disturbance, like people can become more angry, more aggressive. It increases stress. So we recommend that people do not, you know, this is why we recommend not use alcohol, not consume any substances. We want people to find healthy strategies to deal with the stress. Okay, sometimes people don't realize that their anger is because the emotions has affecting them in responding to others. So definitely very important to take care of your mental well-being. So learn to manage low mood and anxiety what we want is that you identify practical ways to structure your day and promote healthy habits to increase positive mood and reduce withdrawal, to explore the importance of self-care and modeling, because when you say modeling, your kids are watching you, your family members are watching what you're doing. So it's important to be models. If you are an employer, your employees are watching how you take care of yourself. So be good role models in this. Manage your thoughts and your feelings. It's very important to know that you're also paying attention to that. Helpful communication techniques. When we have helpful communication techniques about I feel, I would prefer, rather than being accusing people, rather than being aggressive. So understand, because words can be very hurtful, language matters. So reflect on how you use this time as an opportunity for developing resilience. Remember, we talk about that. How do you then find that a strategy to build your resiliency? So we have to start by continually exercising. What are the resources that are available for us to do that? There's apps, there's videos, so many things that are available that we need to do that. So tips for taking care of yourself are very important. Do things that are good for your mind, for your brain, good for your body. You need to make sure you stay connected. It's also important to listen to your body, to find someone that you trust, that to talk to, avoid unhealthy ways of coping with stress. This is very important. So sleep, good sleep hygiene, good food for your body, and taking care of your relationships. You need to know what are your anger warning signs. Be aware of what makes you angry. Respond, not to react. Surround yourself with people who they will support you. The attitude of gratitude is very important. The attitude of gratitude helps our relationship to grow. And so we need to be able to remember that. So protect your mental health. So by protecting our mental health, we know that this is a very challenging time, and that yes, we may have situations where we get very stressful, we get confused, we get scared, we get angry. We know that. But then there is things that we can do to be able to protect ourselves. So again, tips in terms of limit your social media, watching so much news. You want to avoid rumors and misinformation. You want to get your information from trusted sources. I mentioned the importance of exercise or meditate. Maintaining close contact, emotion. We talk about physical distancing, but emotional closeness. You reach out to people, and if you find that you need professional support, I'm so pleased that we will be hearing from Dr. Khan. So in Trinidad, she will be able to provide you with some resources that you may need if you need to reach out to someone professionally. And again, here, we want to normalize that it's okay to do that. I don't know, I brush my teeth every day because, that's part of my dental hygiene, but I also have to go to the dentist for a more deeper cleaning, and that's normal. Why not? So I think the same thing happens when we think about our mental health. If I am taking care of my mental health on a daily basis, but if there's something that is not really, when we talk about the stress, when we talk about the disorder, when you reach into the point where things are not working well, consult. That is okay to do that, just like we do that with our dental hygiene. Even with your eyes, you get to a point where after a while you need to wear your glasses because you're not seeing well, so you have to go and change the glasses. You need to consult to a professional to see if we're coping quite well. So I think it's important that we really invest in our mental health. So you reach out to professional, trusted people. And of course, we need to establish healthy habits by taking regular breaks, not missing meals, and making informed choices, making informed and intelligent decisions about your health definitely matters for us. Okay, so remember that mental health matters, that there is no health without your mental health. Thank you, Dr. Malcolm. So I pass it to Dr. Khan.
Thank you, Dr. Caetano, for such an informative presentation and for sharing those great tips. Although it can be difficult, Dr. Cayetano's presentation reminds us that it's important for us to consider our own health and our own needs as well as those of the persons that we're caring for. Because if your health start to suffer, then those persons that you're caring for will not be able to reap the benefit of the service that you're providing. So remember, you cannot pour from an empty cup. So you have to ensure that you are filled in order to be able to provide the care and support to the persons you're caring for. We notice some persons have their hands raised for comments and questions, but just to ensure that we get both presentation in and have adequate time for the discussion, just hold your question, hold your comment, and after Dr. Khan's presentation, then we'll have that era where we'll unmute your mic and allow you to make your comment and give your questions. So our next presenter is Dr. Khatija Khan, and Dr. Khatija Khan is a clinical psychologist and a neuropsychologist and a lecturer in the Faculty of Medical Sciences with the University of the West Indies, Trinidad and Tobago. She's also a member of the University of the West Indies COVID-19 Task Force. She is also an executive council member of the Caribbean Alliance of National Psychological Association and a past president of the Trinidad and Tobago Association of Psychologists. For the past 20 years, Dr. Khan has been a passionate lecturer, researcher, clinician, and public advocate. Since the COVID-19 pandemic, she has worked with various stakeholders to promote psychological coping and well-being through public education, research, and capacity building across the Caribbean. So Dr. Khan will share with us some resources that U.S. caregivers can tap into in order to protect and care for your own physical and mental health. So Dr. Khan, the mic is yours.
Thank you, Dr. Malcolm, for your welcome, and good afternoon to everyone. It's good to see so many of us giving up a little bit of our Friday afternoon to talk about this very important topic. And kudos to PAHO and the Ministry of Health for highlighting this issue. And I'm glad that we're including a definition of carers for not just healthcare workers and professionals, but also for persons who are doing this perhaps in a personal capacity, caring for their loved ones, caring for family members, parents, etc. So I'm actually not sure if I have permission to share content.
You do.
Okay, it's not it's actually not responsive. In the interest of time, if it's okay, Tara, perhaps you could share it for me, and I can just because it's not responding.
Sure. Dr. Claudina, please pass the presentation right to me.
Okay.
That's what's happened. Okay, so let me see. Where I am? Where's my name? Okay. So, I probably need to pass it to Dr. Khan.
Yes.
Okay.
Let's try that.
Yes. So, yes, let's try that. Yeah.
Oh, there we go. Yeah.
My apologies. Are you okay? Yes. Fabulous. Thank you.
Great. So hopefully everybody can see the screen.
Yes.
Yes, we can.
So let's jump straight into it. So we're going to talk, I'm going to continue along the theme of what Dr. Cayetano was talking about, but I wanted to focus in on how we can leverage local resources that are available to us. So I wasn't sure how wide a Caribbean audience we would have, so I haven't made the slides too specific to Trinidad for that reason. But just to recap some of what has been said already, that this pandemic is unprecedented in our lifetime, and what it has done is it has led to heightened levels of stress across the board for everyone who's involved. So whether you're the carer or the person who's being cared for, and what we've seen is that this pandemic has provided sources of stress in every different category you can think of. It has been a major disaster, more so for some countries than others, we are also now faced with a number of different life changes and strains, which are still ongoing. It is a chronic stressor because we are months into the pandemic and we are still not sure. There's still a level of uncertainty about how it might play out, especially as we read about second waves happening in other countries. It also poses daily hassles. So even if it's a little thing like the internet connectivity or trying to get permissions to share a screen, we find that we're going to have all of these additional sources of stress compounding what we experience in our everyday lives pre-pandemic. So because we know that we are faced with these heightened levels of stress, it is really even more critical that we are able to address this in our personal and professional lives. But the thing about stress is that stress, well, first, Dr. Cayetano mentioned that not all stress reactions are negative. Not all stress is negative. But it starts to become negative and distressing when we perceive that it exceeds our resources to cope with it. When the threat seems too big for us to handle. So stress reactions can be very subjective and it can be very variable. So people are going to react differently often to the same stressor, and you may react with a different intensity than somebody else. So there is no one way, no one prescriptive way to respond to stress. It is very subjective and very variable. And therefore, if we are responding differently, then there is no one solution that's going to fit everyone. So we then need to have at least the tools and the strategies to figure out how are we going to combat the stress and how are we going to help preserve our mental health so that it stays within a healthy range. So in this study, they asked healthcare professionals, what do they want from their organization? What do they want from their leaders and their managers? And they summarized these into these 5 P's. So these workers wanted from their leaders, they wanted them to hear me, protect me, prepare me, support me, and care for me. And so all of these now are going to need to be addressed in different ways. So as you read this list, I want you to think about your own context, about what you need from the people around you. So if it's in a workplace setting, what do you need from your leaders and managers? Maybe some of this has already been addressed appropriately. Maybe there are some gaps in some areas. So that's the first thing I want you to do. And as we go through this, as Dr. Cayetano in her presentation listed the different areas that will be affected and how you could address these areas, I want you to do a similar audit and think, as we talk about addressing these, where are the gaps that exist in your context, and then how can we get those gaps addressed? So let's look at a different level. So let's look at that organizational level. So for our care level, it might be that organizations need to have fora for input and feedback. So one way of doing that is if you are a leader or manager, have you asked your workers what they need? Because sometimes what you think people need may not be what they actually do. So you may think they need support in some way, in a particular way, but if you talk to them, maybe they need support with childcare, maybe childcare is an issue. So until you actually speak to people, we don't want to assume. And so organizations need to have these fora. So hopefully, now these can occur in different mediums. So you can have meetings like these where people discuss, or a staff meeting online. You can have an avenue where people can email. But it's very important that no matter what way you decide to do it in, that you do feel that there's a forum for which your voice is going to be heard, but you also get feedback on the contributions you're making. In terms of support, so that could be at a health and safety level. So first, perhaps it pertains to equipment, it pertains to personal protective equipment as well, taking you have to fit into the COVID-19 pandemic. Support might also be in the form of are you receiving adequate training and supervision? Are there adequate channels for communication? So you are informed on a timely basis and you're equipped with the information you need to perform your duties in the best way. Organizations also can provide support for emotional and psychological needs. So many of our large organizations do have employee assistance programs where employees can access individual therapy. Sometimes there's a limit on those, so usually, I'll use the example of Trinidad, sometimes it's happens at 3-4 sessions, but hopefully that's enough that at least meet some caregiving and to provide you some support. There may also be some telephone helplines. Another formal way of providing support in an organization sets up a buddy system. So you paired up with someone, and the role is you have somebody now to check in with, somebody to talk through when you've had a difficult day or when you've had an emotional event happen. You have somebody you can check in with and speak to about it. Having an online repository of resources is also a very good thing. But it could be that your local organization may not have its own dedicated website or internal repository. But as you'll see, I'll share some other resources with you. There are many of these available regionally. So even if your particular organization doesn't have one, you don't have to look too far to find a local or a regional resource. Now, another way that organizations can care for their workers is also affirming and recognizing that effort and the sacrifice and the commitment that carers are making on a daily basis. And so it doesn't always need to come from patients or the people you are caring for. Sometimes you want the people you work for to acknowledge that you are making that effort. And not just take it for granted that because you're an employee, this is what you're supposed to be doing. I think just the human part of us still likes to be affirmed, no matter what level we are in the hierarchy of the system. It's something I can say in my workplace, no matter where you are at. I think some people do have that need for affirmation, for recognition of your effort and your sacrifice and your commitment. So at the social and care level, there are also ways that you can identify resources for helping take care of yourself. So I mentioned the buddy system, and that could be done formally, but could also be done informally. And I know that many of us already have this in our workplace. There might be that one person or a small group that you do share experiences with. But I did want to highlight to you that this seemingly organic and spontaneous help seeking is actually really important and beneficial. So some of the meta-analyses have looked at the importance of social networks and strong social support with outcome potentials. And you can see from that study I've cited, it's a pretty huge outcome that's associated with having strong social relationships. So the patient is associated with a 50% increase in survival rate. And so there are also benefits for us socially, personally, for having a good, healthy social support network. So that can come from having a buddy. And if it is that you're a personal carer, then perhaps that buddy could also be another carer that you could share who can identify with the experiences that you have. Now, your social networks and groups, as I mentioned, could be recreated, they could be social as well. So there are many groups. So we have the mention of apps. This is an example, the picture on the screen is an example of a Facebook group, which is Moms Health and Fitness. And so although they're a health and fitness group, what I like about them is that their concept of health is not just physical health. It's physical health and mental health. And we've been hearing over and over, it cannot be understated that physical and mental health are inextricably linked and both are equally important. So having being a member of groups like these can also be an important source by which you can help take care of your mental health. You could also crowdsource options and solutions. So anything that you're looking for, so even if you were interested, you wanted to join a group, or you're looking for an exercise group, or you're trying to find a particular service, we can now leverage the technology that's available to us. So we can use social media and we can find out what other people's experiences are, how have they been problem solving? And that is very more for us as well. So leveraging the social networks is important. But there's a caveat. And the caveat is that the quality of the social support is important. Okay, so it's not just any social group that's going to be beneficial. It's going to be what kind of people you are in. So what they've found is that if you have a social network that is characterized by a high level of conflict, but to use some local parlance, plenty bacchanal, then what we find is that that social network is not going to be beneficial. So there is a lot of conflict. People are going to show poor physical and emotional health after a major stressor. So please look at the quality of your social network. Do an audit of your social network and make sure the ones that you choose to invest more time and energy in the mental space with are the ones where you feel they're beneficial, they're supportive. And another benefit of having the social networks is when we have limited resources as we do in the region. So we know that there is sometimes limited access to public health networks. So there might be long waiting lists and waiting times to see a mental health professional. Some people can't afford to see a private mental health professional. Then social networks can also help fill that gap. So especially if they are healthy groups, they can provide some of that much needed support and coaching. And there are very many benefits that show how group support or support groups can also help with mental health. So moving on to the level of the individual. So I put up this wellness wheel, what is called a wellness wheel, and it highlights some of the different aspects about individual wellness. And all of these are important. Arguably, some variably important to others, more than others. So the intellectual, you might prize more than say the social or the spiritual. So this is going to be a variable unification. But I also want you to think about it and think about what are your needs and how do you get them met? Where are you going to find the resources to get them met in the local sphere or in an accessible sphere? So for example, financially, if you are having struggles as a result of the pandemic, that can be a very significant stressor. And we know that many people have been affected financially. There's some people who have suffered job loss within the family, and that has a huge impact on the household. So we want to be able to identify resources that are accessible and available within your local communities and contexts. So for example, the banks or the lending agencies that have been giving concessions on loans specifically for the pandemic. So they might give you a little period of say 3 months where they're not going to forgive it, but they will delay it. And so being aware of resources like that, but also understanding that if it poses significant stressor, and if you don't address it, it's going to augur poorly for you. It's important for us to do this audit and see if we're getting those needs. Yeah. So keeping on that individual realm, many times the things that we need for self-care don't necessarily require a lot of external resources. So it may not require, let's take exercise for example. Exercise, when we were in a period of lockdown and different countries are still on various levels of restrictions, that might affect your ability to go to the gym. But exercise you can do at home with no additional cost. So I want you to, as you're thinking, to make a list, make an inventory of the things that bring you pleasure, the things that will allow you to relax, so that in your mind you have this inventory. So on the day when you particularly need some help, you can select one of those and engage in it. So for example, if you haven't engaged much in nature, so during the lockdown when we were restricted from going outside, many of us would have been deprived of the opportunity to engage with nature. So you might think, well, how can I get that movement now? So you can go for a walk, you can go to the beach, you can spend more time in your garden. So if you have these lists of things that bring you joy, and this list is going to be different for everybody, so it's important to have these repositories in your head. Okay, we'll do that. This thing off.
Sorry, Dr. Khan. Yes, your sound is coming in and out at times. So if you can turn off your video.
I'm just going to end the show for a second so I can access the control. Okay, are you hearing me better now?
Much better.
Okay, my apologies for that. I know it's stressful in itself when sound is dropping in and out, and you can't hear very well. So just to recap that last point, in terms of your individual and self-care, just going back to, let me go back to the code. Okay. So having your own personalized inventory of things that bring you pleasure. And it's important that you tailor this to your own needs and availability and budget, so that you explore options that you could pursue on your own or which are locally available. So for example, many plant shops have been reporting an increase in sales, and many people have been engaging more in having their own kitchen gardens, their own food gardens, etc. This also was stimulated during lockdown when we had the closure of all the restaurants and food places, and so more people were cooking for themselves. And so here's a case where something that might have been stressful, we have also had a positive outcome. So some of you may be engaging in more gardening, whether it's a kitchen garden, so for food sustainability, growing your own food, or whether it's a flower garden. So I have a succulent garden and it brings me a lot of joy. So other things, so other people too, in terms of identifying local resources. So there was a now that mask wearing has been heavily promoted as one of the public health measures to slow the pandemic. We've seen a lot of people who are taking that up upon themselves. Maybe you have been making your own masks, or maybe you have been supporting people who are making their own local masks in your community. As the restrictions are lifted, the borders are still closed. Maybe we are considering more safe returns instead of we're all hoping about when will we be able to travel, but instead we can turn that around and think, you know what part of my country, what part of my community have I not explored yet? Using technology to help us in terms of online shopping, in terms of means for online communication, for entertainment. Those are also ways that we can exploit what we have locally that's available to us. So in keeping this focus on accessing local resources, so this slide I want to urge you to go local. And there are many reasons why we need to do this. Even if we think about resources that are available, when the internet is right, there is so much information on the internet. But local information is for us and by us. Local resources tend to be more relevant. They are culturally valid. They're also ecologically valid because it's based on our context. Local resources are usually more available as well, and also they're very empowering. So utilizing local resources also empowers a community, builds capacity within the region. It helps their agency both at the individual level and at the organizational and national level. So speaking about those local resources, as it pertains to things like information and guidance, it's really important that we know what the valid sources of information are locally and regionally. So on this screen, I've listed some of those things, and many of these you may already be familiar with. So PAHO, and as I singled out the page for mental health, CAFA also has information dedicated to COVID. The UE has been doing a lot of work in a number of different areas. So the task force has its own dedicated website. UETV, which has free programming on the Flow Cable Network, has a number of programs dedicated to helping, giving information, helping people cope. As I speak about UE, we also engage in a lot of research. So for example, I'm currently working on a project in collaboration with PAHO and Dr. Malcolm, and hopefully soon we'll be able to share some of those results. And the fantastic thing about that is these results, that data, that information is based on us. We've collected that data locally. So we're not trying to extrapolate from international findings. Some international findings are applicable across the board. I do apologize. I'm hearing that the sound is poor again. But the good news is I'm almost finished. So
Go ahead, Dr. Khan. Yes, go ahead.
So just the last few resources, as you can see there, the Caribbean Alliance of National Psychology Associations, we have resources on the website for mental health workers and psychologists, SIDEMA, and also pay attention to our own local Ministry of Health, the regular press briefings. Our Trinidad and Tobago Ministry of Health has, in addition to the resources we already have online, are compiling a list of mental health and psychosocial resources as well that will be available. Medical associations and psychology associations are also good sources of information. So finally, we heard it from Dr. Malcolm, Dr. Cayetano alluded to it, and I do want to emphasize it again. You cannot pour from an empty cup. So it is in our best interest. It's also good ethical and professional practice for us to pay good attention to our mental health. So thank you very much for your attention, and I look forward to your questions.
Thank you so much, Dr. Khan. Again, we apologize for the sound. There's some section of our presentation that was a bit difficult to hear, but the slides were showing, so also you were able to get some of the information from the slide. But again, it's part of the new norm. It's some of the challenges that we have to deal with on a daily basis, and it's also one of the things that can also contribute to some of the stresses that we go through each day. But I really want to thank Dr. Khan and Dr. Cayetano for those great presentation, and some of the key points that I've taken from both the presentation is that you cannot care constantly without taking a break. It's important for us to take a break as caregivers in whatever aspect that we're caring, whether it's professionally or personally. Even though it's often not easy to do so, it is important for us to ask for help when we need it. And getting into the habit of making time for yourself as a regular part of your day is important, and you should never feel guilty about taking that time. Dr. Khan also share with us and explore some of the options and resources that are available that you can tap into. So it is time for the question and answer segment. And I would like to hand over to Dr. Hazel Othello, the Director of Mental Health in the Ministry of Health, Trinidad and Tobago. Dr. Othello, the mic is yours. Please go ahead and unmute your mic.
Good afternoon, everyone. I hope you're hearing me clearly. Are you hearing me clearly?
Yes, I am.
Okay, so I've only seen one question so far, and it's from LaRon Highland, who asks, it seems to me that for the most part, Caribbean people tend to be reluctant to interface with mental health support systems. How do I help a colleague with signs of stress to get help without offending them? And she directs that question to both panelists.
And just to add, Dr. Othello, sorry, there are 4 persons that have their hands raised. So you can also look at that as you go.
Sure.
Would you like us to respond right away, Dr. Othello?
Yes, please do.
Okay. I hope you can hear me better now. My apologies for the attendees. I now understand, I'm seeing the chat, that the sound quality was poor. But jumping straight to the question, if you have a colleague who is not very keen on interfacing with the mental health support system, so the first sign I think is talking to your colleague and it's expressing that concern. So I think reaching out to people with a non-judgmental attitude is often a good way to start opening up the conversation. So, Taraline, how are you doing today? You look like you've been having is everything okay? So opening up the conversation in a non-judgmental way starts, and you can offer suggestions, but I do want to highlight that we can't ever force anybody to do anything that they don't want to do. The most we can do is offer support. So you could explore with your colleague what the options are. Do you have an AAP service? Maybe they want some company to go to the appointment. Are you willing to extend that kind of help? If not, what you also need to think about is how much do you want to be engaged? How much do you want to be involved with your colleague? If it's a close friend, you might be more amenable to helping them identify those resources. But I will say that keeping the lines of communication open is really important. Letting them know that you're available to talk is one really good step to help your colleague. And just to finally answer that, you might also want to advocate in your workplace for more mental health resources for employees. So I spoke about having an online repository, and I mentioned that the Ministry of Health is working on one. So for example, the international company Johnson & Johnson has a fantastic range of resources for their nursing employees. PAHO has a fantastic range of resources as well on their website. So in addition to suggesting that they go face-to-face, it could also be that they can access some self-help resources through accessing information. Thank you.
Your mic is muted, Dr. Othello. Please unmute.
Thank you, Dr. Khan. Are you hearing me?
Yes, we are.
Right. So we thank you for your feedback on that question, Dr. Khan. Is there anything Dr. Cayetano would like to add on that question?
Thanks, Dr. Othello. I think the answer provided from Dr. Khan makes a lot of sense. What we need is to start to encourage, because even for PAHO, for us as employees, there is a mental health, there's a well-being clinic. And we are afforded, if we want to contact, we have a counselor that we can tap into. So I'm also glad to see that within our own organization, that is recognized, the importance of taking care of your mental health. The issue is mainly the stigma that people don't want to be, talking about that. So I think the change that has to happen is the modeling of behavior to decrease stigma. We know social contact makes a difference. So I was very pleased the other day when one of my colleagues told me, after you recommended that I contact the clinic, I did. Oh, it makes such a difference for me. And so I was saying to her, do you mind because I have other people who have been asking me about help, but I'm not providing any clinical work. My work is public health. So I asked her, do you mind if I tell them about your experience? She said, no, tell them because I really like it. And so it became easier for other people to know that if I could do it, you can do it too, and that's okay. So I think these are opportunities for us to make sure that we encourage people to look after their mental health, that nothing is wrong by doing that you can still be a strong and a healthy person by doing that. That's why I want to start with the concepts of the different levels, so then it's not that you will always be like this forever. This is transient. You get better and you have different situations that you have to be confronting. Yeah, thank you.
Thank you, Dr. Cayetano. I see Akil Wallace has a raised hand. So Akil, can you ask your question or make your comment now?
Go ahead, Aki, your mic is unmuted.
Okay, I did type the question in the chat. I'm sorry that it didn't show, but the question is, I know someone who recently had a traumatic breakup with their spouse. They struggle with anxiety. So I'm looking at the pyramid that Dr. Cayetano presented, and I'm wondering if that person has escalated from a mental health problem to a mental health disorder. So I'm asking what symptoms will determine if that person has an anxiety disorder.
Okay, Dr. Cayetano.
And I know that
Cayetano,
I'm sure Dr. Otello can answer your question. But given that, or Dr. Khan, but and please feel free to jump in here. But given that the question was addressed to me, but I really like that we get feedback from our colleagues. So when we talk about mental disorder, remember the difference is that it impacts your functioning, the person functioning at work, at school, or at home. It becomes they're not functioning well. So their concentration, their sleep, remember I talk about their behavior, all of those things are affected. So the functions is important. The length of time, the duration is important, and the symptoms that they are they are expressing, you're seeing. So I think one thing is, when we talk about demoralization, the mental health problem, because she's heartbroken, she has a loss, and those are normal things. But it becomes a disorder when it hinders their function. People are no longer functioning as normal as they used to be before. So this is something important, and I don't want to. So in terms of as I mentioned before, we try to encourage people not to diagnose on a symptom, on a sign. We try to explain to people, if this is really affecting you. I think I like what Dr. Khan said. Maybe you may want to consult someone professionally. It's the professional that we want to be available to do the diagnosis. We cannot make any diagnosis for people if we are not qualified to do so. So I think I'm glad that you're raising the question, you're caring, you're concerned. And if you feel like it's affecting how the person is relating to the children, to herself, encourage that they seek help, and make sure that you tell them that this is something that is important to do in order to continue caring for herself. Dr. Otello, you may have. Dr. Khan, I pass the mic to you.
Khan, would you like to add anything?
I think Dr. Cayetano could have covered it. Just to just add one point to enhance what she said. So we're looking for impairment in functioning for it to tip over into what we would call a disorder, or diagnosable or clinical range. And that could be in personal life, in your social life, or in your work life.
Right.
But also to remember, we don't want to pathologize normal experiences that humans have. When something sad happens, it's okay to be sad. When we feel hurt or betrayed, or we're dealing with something difficult or traumatic, those things can fall within the range of normal human experience. So sometimes we need to give it some time, and then if you find that the impairment continues, that they can't get past it, they're not recovering and able to function as they were before, then that might be the time they want to seek some help. Thank you.
I think the only thing I would add to that is that sometimes, even though it may not escalate to the level of an illness, there may be aspects of the way that stress is affecting somebody that they may need some assistance to deal with. For instance, you don't have to have a mental illness for stress to affect your sleep or your appetite or your concentration, things like that. And if you're having difficulty with those things, you may need some professional help in order to overcome that. So the important thing is that whatever areas are being affected, as long as it's beyond your capacity to cope on your own, and it's beyond your capacity to cope with the support of friends and family, then we encourage you to seek additional help so that someone can help you. It might be a general practitioner, right? Sometimes you may need a short course of medication to assist with sleep, just for a short period, just to reset your sleep cycle. That person would also help you with, healthy sleep tips so that when you stop taking the medication, you continue to sleep well. So lots of resources like that are available. And then if your general practitioner thinks that they need additional guidance from somebody specially trained in mental health, they would advise or refer or whatever. So start at the level of the resources available to you, friends, family, pastor, community support groups and things like that. And if the support available at that level is not meeting the need, then another level may be required. That's all I wanted to add. I'm not seeing any other raised hands. Did I miss someone? Yes, I just saw one. Trisha Ma. Go ahead, Trisha.
There's a question in the chat.
For some reason, I'm not seeing the questions in the chat properly.
There's a question in the chat, Dr. Othello, that says, my concern is, how do you reach out to individuals of low socioeconomic status who are frustrated, no money, no food, job cuts in a challenge in Grenada? That's one, which I think is very important, that sometimes we tend to think that if poverty or low socioeconomic status has to do with mental illness. Rich people with a lot well-to-do have mental illness, have mental disorder, have stressful situation. So let's just make sure and I would like to also get your feedback. The concern is that if you frustrate, so it's not the lack of money. Remember, people who have money can also be frustrated, can also become upset. So people who have a good job, who have things, that can happen. Is how do we respond? I think here the issue is our response to stressors. Yes, we understand that person may not have a job. We understand that the person may not have some money, but they still need to take care of themselves. They still need to take care of their mental well-being. They need to be well in order to continue, because this can be transient moments in their life. It's not forever. So they need to be well, to be able to seek help, to seek jobs, to seek support. So this is what I think misperception sometimes is, that we think, oh, because they don't have anything, and so, it's normal. It is not normal. It's the same thing with someone who has diagnosed with HIV, diagnosed, let's say, maybe with diabetes and so many other clinical conditions, sometimes even cancer. We say, oh, it's normal to be depressed. Oh, it's not normal to be depressed. Depression is an illness. So it doesn't matter. So we have to distinguish that, I think. So the low resources, poverty is not equal to mental illness. That would be an error if we think that way, because we also know that well-to-do can have problems, because we're all human. So there's that interrelationship. So remember when I did the presentation, language matter. So this is very important, that even if you don't have any resources, economic resources, you can still do something for your own mental health, just like you do for your own physical health. Dr. Othello or Dr. Khan may want to add to that, but it was a question in the chat.
Just to add one thing now. So the question I was asking about persons from a low socioeconomic background and persons in communities, and how do we get help for them. So again, we're facing those restrictions. We have limited resources, limited access to public health resources, and also having individual face-to-face interaction with a mental health professional is one of the most expensive ways to deliver resources. So I think what we need to do is to continue to expand our focus on capacity building within communities. So we need to empower people in communities to champion mental health, to serve as role models, more community interventions. So whether that comes from psychoeducation, where we just educate people, there's a lot of stigma, a lot of myths about mental illness that are very pervasive, and they get passed on. So we have to counter that with the education. And so when people are armed with the correct information, then we can equip them with some tools that they could use themselves. So self-help tools, so be it the stress relief or how to live with a mental illness, how to support a family member or loved one with mental health challenges. So I think more capacity building, more empowering of communities is going to help. Thank you.
Thank you.
Okay, are there any other raised hands? I'm not seeing any. Am I missing anyone?
Yes, there is a question from Corinne and Yvonne Lewis and Justin. So we'll go with Corinne first. Go ahead,
I
Corinne.
don't see any questions at all.
And sorry, Corinne, before you go, just to indicate that Dr. Caetano has another meeting at this time, so she'll have to leave us. But the rest of the team will be able to take the rest of the questions. So thank you so much, Dr. Caetano, for your presentation. And we look forward to the continued collaboration with you.
Dr. Malcolm, before I leave, thanks very much. There is something in the chat that says it's not easy. Your workday becomes longer. Plenty time is on meetings, seminars, especially the virtual platform. We have to find a new normal for extra rest and mental health. And I thought, how appropriate that chart. Because actually, I'm leaving because I have another virtual meeting, which is a very important part. It's another virtual meeting, it's departmental meeting. But I think this is part of the challenge, and how do we respond to that? So we don't always have to be in everyone, we just have to be selective. It's the same, selective in what it is that we need to say. Sometimes you need to say no, and I think Dr. Malcolm said that. Don't feel guilty in taking care of yourself. Don't feel guilty if you don't have to be able to be available for everything. That's understandable. So the reason I'm not feeling, I feel like I have enjoyed this conversation. I wish I could stay until the end, but I'll be able to listen to the recording. Thank you very much for the invitation. Thanks, Dr. Khan, for joining me. Thanks, Dr. Otello, Dr. Malcolm, and the team at Ministry of Health. And of course, my kind regards to also Dr. Wheeler for supporting this. Have enjoyed the rest. Please stay. It's only me leaving. And I will listen to the recording, and I will also send my presentation so you can share with the group. Thanks, Dr. Malcolm. Bye-bye.
Thank you. Thank you, Dr. Caetano. So, Corinne, you can go ahead. Dr. Otello, I'll just help you in terms of show.
Yes, please, because for some reason I'm not seeing them.
Okay. Go ahead, Corinne. Corinne, we're not hearing you and your mic is unmuted. I'll mute your mic, so go ahead and speak. All right, still not hearing you, Corinne, so just check your audio and then we'll get back to you. Ms. Yvonne Lewis, floor is yours.
Oh, good afternoon, everyone. I would have put it in the chat. I would have put it in the chat, but I'll read the question. And I'm saying, apart from the services like EAPs, which is very important part of a supportive environment for employee mental health, and I've seen it work extremely well for some of my staff. What are some other provisions the health organization, in this case, well, I was a part of Ministry of Health, I've just retired, but organizations can put in place to empower and support their staff to function, cope, and manage the life stresses, because these things come into the workplace. So sometimes I see the EAP coming from a more deficit paradigm, but I'm thinking in terms of coming from a paradigm where we're putting something in place to help people who are well functioning to stay well functioning with respect to every aspect, physical, mental, social. And sometimes we take the physical on board. So we have staff health screening, and we let them monitor their blood pressure, blood sugar. They're healthy, but we're providing them with information that they can take action on, and they can have early idea if there's anything going off. What can we do from a mental health standpoint to help the well staff who are managing well continue to manage their mental health well, and not wait to the point where we're seeing something negative and then wanting to refer for support? Thank you.
If I can address a few of these questions. So some may recall a few years ago, the WHO, the theme for mental health day was mental health in the workplace, because we do recognize that it is such an important issue. And since the pandemic, it's also a topic I've been speaking a lot on in terms of how can we manage stress and promote good mental health in the workplace. So apart from the EAP services, and you're right, Ms. Lewis, that is, those are engaged after a person has reached the point where they need some other professional help. But there is a lot that workspaces can do. Now, Canada has been one of the countries that has been promoting an assessment of the mental health of workspaces. And so looking at how psychologically healthy or psychologically toxic your workspace is. So in terms of what the organizational culture is, how do they promote healthy mental health cultures? From everything in terms of how you communicate, what are the relationships like? How do we affirm, reward people? Is it equitable, etc.? So in terms of looking at those softer aspects of organizational culture, I think it redounds very significantly on people's mental health in the workplace. Also, there are other policies that workplaces can adopt. So especially in terms of this pandemic, in terms of having flexi time or promoting or facilitating remote work. But this would involve with being in touch with what your staff is experiencing, what are their needs, and are you responsive to their needs, so that we're not adopting this authoritarian approach of here are the rules and you need to abide by them, and here is my archaic view of what productivity looks like, and you must be sat in a seat from X hour to X hour, and that's why we have things like presenteeism coming up. So I think responding to the toxic aspects of organizational culture, being able to have organizations do that audit and address them is going to be very important. Thank you.
So, Dr. Khan.
There's another question in the chat. What do you do if stress affects your sleep or your energy? Like you're not feeling any energy in your body and you're having changes in your mood and your attitude. So Dr. Khan, do you want to take that?
Yes, I think myself and Dr. Othello can adequately answer this one. Well, I think it's a good thing that you're self-aware, that you are recognizing that this change has occurred. And if you are feeling those things, identifying the source is also going to be helpful. So what changes have taken place recently? What is going on? The more self-awareness you have, you might tap into it. So it could be that it's increased demands either at work or at home, etc. And so we want to find out what the source is and if there's anything we can do there. You can also tackle those individual symptoms. So if your sleep is being affected, you can have a look at your sleep hygiene. So when we talk about hygiene, we usually associate that with things like cleanliness, etc. But sleep hygiene is an increasingly important concept because we know the value of sleep and how it can affect us in many different ways, physical and mental health. So sleep hygiene looks at all of the things surrounding sleep. So in terms of what's your routine, what are you doing, what is your sleep environment like, the room, the bed, the lighting, etc. And seeing what you can tweak in order to help that sleep quality. So you can tackle that in both ways. You can look to address the symptoms directly. So something like a loss of energy. sometimes the solutions seem counterintuitive. So sometimes people think, well, exercise is going to tire me out, whereas exercise can actually energize you. So you can tackle the symptoms themselves, but it's also important to get to the source of the stress and tackle that as well. I hope that helps.
So, Dr. Othello, just to continue to assist, since you're not able to see the raised hands, we have Sharian. Sharian, you can go ahead. Go ahead, Sharian.
Are you hearing me? Actually, one of the other presenters would have answered the questions, the both questions that I put in the chat. I had the concern from Grenada, and
okay.
They did mention it. So thanks.
Thank you, Sharian. And then Justin.
I'm not seeing any of that.
Go ahead, Justin. We're not hearing you, Justin.
Is there a thing to scroll?
So I'll move to Karine. Karine, can you check if your mic is not working?
Hi, Dr. Malcolm. I just want to point out, I think Anthony Ganesh and Leslie Garcia were also in the queue for a while. I think Leslie had put a comment in the chat.
Yes, yes. All right, I think I'm at Anthony. It's not hearing Karine. So Anthony, go ahead. Go ahead, Anthony.
Good afternoon. Can you all hear me?
Yes, we're hearing you.
I actually had put my question in the chat actually, and I was asking basically, what can employers do to capture and actively promote the mental health of their care workers? Yeah, was a basic question.
So if I heard that correctly, is what can employers do to promote the mental health of their employees?
Of their care workers.
Capture and actively promote the mental health of their care workers. Of course, keeping it in the context of the webinar.
Right, yes.
We speak about employers of healthcare workers or workers who provide care agencies, etc.
Right. So the other thing I think that has come up is care workers are also at increased risk for things like burnout and compassion fatigue, secondary trauma, vicarious trauma. So I think recognizing the specific concerns that they might have are important, but even just dialing back, that communication is really critical, having two-way communication. So I think engaging with your workers, providing a forum where they can identify and express what their needs are. So it could be that their needs are, it could be burnout and fatigue. It could also be frustration with some other aspect of the work situation. So I think definitely having as a first step that open communication and a regular manner. So you have a timely point where you engage with your workers and you find out what's going on with them, what are their needs, and follow up as well. So out of that initial conversations, whatever you decide to implement, you do need to have the follow-up to evaluate it to see if it has filled the gap. Maybe it hasn't and you need to tweak something else. So I think starting with two-way communication is very important. And I think having employees, leaders, and managers who do role model a sense of your health is important to us, we value it, and we're willing to do something about it, it goes a long way to foster what I mentioned, a psychologically healthy workspace.
So the next hand that is raised is Leslie. Leslie, your mic is muted. Go ahead.
Hi, is my mic off?
Yeah, I'm hearing you. Go ahead.
Good afternoon, everyone. Thank you so much for your presentations. It's great to see this multidisciplinary approach to mental health for carers and the general public. I just wanted to put in a word for the discipline that's often missing in the mental health array of services, and that's occupational therapy, where we are not so prevalent in the public system, but people are available in the private sector for now. And so really, I just wanted to say it's so important that we collectively do what we can to get all of the services fully fitted out, including all of the disciplines, including social work, nursing, psychology, psychiatry, and occupational therapy. I really enjoyed hearing the really practical things that impact people's mental health, and those things are occupations. They're the everyday things that people do, from sleeping to gardening to having a cup of tea to talking to a friend to even the activity of thinking itself. And those are the occupations, the activities that occupational therapists are uniquely trained to work with people on their own solutions, so that they are satisfied themselves in their own health and well-being and their recovery from traumatic experiences, which could be the everyday, experiences from life, from being alive, to things like living through a pandemic. So I just wanted to put in the voice of occupational therapy on behalf of the profession, and say that we're here, we're in Trinidad, we're in small numbers, but we do exist, and there are practitioners in the public setting, and hopefully we'll have more and more. And I really hope that the people listening also advocate, because it's everyone's right to have access to all of the disciplines that are available, and ask for occupational therapy to help with your daily activities of living. That's where the rubber meets the road. Right. So that was my comment. Thanks very much.
Thank you for that, Leslie. Indeed, I think, occupational therapy is such a valuable tool to have in the care of patients, and it's applicable in so many areas. And I know sometimes it's frustrating when we don't have a lot of resources or that are available that we know patients would benefit from, but it's also exciting, and it imbues hope. So I know many of us envision a Caribbean, and this is what we're advocating for. This is what we dream about, we work towards, and we're advocating for that time when our patients, the healthcare services, we do have all of these facilities and resources available. So occupational therapy, social work, speech pathology, physiotherapy, that when a patient comes in, that it's a one-stop shop. And if they do need the services of an OT, it's going to be facilitated. So having that holistic approach, treating all of the needs of the patient, certainly I think that is not just the best practice, but the ideal that we're all striving for.
Yeah, I completely agree. In all aspects of the health system, from the hospitals to the clinics, and even the EAPs in the schools. Mental health is, children as well. So OTs across the lifespan should be in all settings where people live, Yes, one day, and one day soon, sooner than later, hopefully.
Yes.
Thank you again.
Absolutely.
I'm not seeing any more raised hand, Dr. Othello, but I think there are comments in the chat. Are you seeing that?
Just a second.
And I realize that we have participants in the group from Denmark. She just sent a message. Jitet. I am an occupational therapist and I'm in Denmark. So she was happy for that comment that you made, Leslie, regarding the role of occupational therapist.
Hello, Denmark.
Wow. Yeah. Please go ahead because I'm still not seeing all the comments on my screen. I'm not sure what's happening.
There's a comment. Is there value in developing gender-specific support or advice for women, since women take on the brunt of burden during the crisis? Many are single parents, potentially living in domestic violence situation, primary caregivers to older people. So would you recommend, or is there value in developing gender-specific support or advice for women? Because women are the ones that have the brunt of burden during this time. I don't know if anyone wants to take that.
As it pertains to gender-specific services, I think the conversation before that one is the importance of having a gendered lens, so that we are able to recognize when there are issues or circumstances where understanding things from a gendered point of view becomes important. So there are circumstances when it is the female gender, and because of their having an additional, say, caregiving burden, that might be pertinent. There may be other situations where the male gender might be pertinent. So I think having the gendered lens is important. And then when we have that lens, we can then decide, well, how is it going to inform interventions and services? Now, so we do find also that mental health also intersects with a lot of social problems. And it could be that tackling those social problems, it might be useful to have services that's specifically for men or specifically for women. So as we say, long answer short, yes, I think it is relevant and it is important to use a gender lens at times.
Thank you so much, Dr. Khan. Sorry, Dr. Othello, for taking over since you're not able to see, but I think that's okay. Bring us to the end of the question and answer. I'm not seeing any more comments in the chat, and I'm not seeing any new hands being raised. So I just want to thank you, Dr. Othello, for moderating this session, and thanks to the participants for the questions and the comments. And I think we have learned a lot during this segment, and the presentations that came before have prepared us as to how we can go about ensuring that we're making the time to take care of our own mental and physical health as caregivers. So I will hand over to Dr. Caroline Allen, the consultant with PAHO Trinidad and Tobago Country Office, and she will highlight some of the key takeaway messages from today's session. So over to you, Dr. Allen.
Thank you very much. I don't know if I can put on my camera, but I don't seem to be able to, but it doesn't really matter. You don't need to see me, except that I was going to show my 4 homemade masks that I have with me, which give me joy. That, you know, I think Dr. Khan was referring us to ways that we can support the local economy, feel culturally centered, and feel that we're making a little bit of difference in our own ways. And I think that's one of the important lessons that came across. I think it's very hard to summarize, but I think maybe I could say that Dr. Caetano's presentation really focused on how we as individuals can empower ourselves in terms of self-care, develop our own resilience, our adaptation, how we can take joy, how we can be selective in what we do, how to say no, and how we can make sure that we're not pouring from an empty cup, as Dr. Malcolm was saying. There was also an emphasis on that in Dr. Khan's presentation. But in addition, I think there was also a big stress on building communities and institutions, building up social capital, building up your relationships with people, and also in institutions such as building the employee assistance programs, and later in discussions we talk about specific professions such as occupational therapy that can provide support. But I think in terms of also that we need to let people speak. As organizations, we need to let employees speak. We need to strengthen those organizations in terms of things like equipment, protective equipment, etc., to enable our workers to care for themselves. But one of my questions is, as a society, are we looking after our ordinary people as well? How has COVID affected our social institutions, our economies? We had a comment from Grenada about how people who have lost jobs, etc., can really care for their mental health. And I think we need to think about not only how people in those situations where things have been taken away by COVID can look after themselves and support their communities, but perhaps, you know, how society as a whole and the government can also support. We need also, I think, well, as a social scientist, I'm concerned with not only the individual level, the community and the institutional level, but the societal level. So how do we tackle things like stigma against mental health? How do we legislate to provide more support so that carers, for example, can get time off work without losing their jobs if they need to care for people, which has been a very important thing that's happened under COVID, is that people have needed to stay at home and to care for children that are at home. And there have been temporary measures to enable them to do that, but how can we support people more by maybe extending that for a longer period in terms of, so that they can take care of their relatives and so on. And I think the last question about gender really struck a chord with me. There is what we call a gender division of labor, whereby in most societies, Caribbean, certainly not an exception, women bear the major responsibility for family welfare, so that the real burdens of care really fall more on women than they do on men. We need to recognize that, while also trying to encourage men to become more involved. How do we encourage, through education, through legislation, through things like paternity rights, to time off, to part-time working? How do we change the whole social and legislative environment to enable better caring? So I think that may be an area where we might want to extend the discussion. So in closing, I think it's important, again, going back to the little example of the masks, that we build bottom-up solutions, that we have our kitchen gardens, that we support local industry, because those are ways that we can, in our own little way, also contribute to eventually this kind of macro level solutions. But we do have to look to governments, institutions, the private sector also to help with supporting the carers. So I'd like to stop there. Thank you.
Thank you so much, Dr. Allen, for providing that summary and for highlighting some of those key important points. I would like to thank the two presenters, Dr. Khan and Dr. Caetano, for their excellent presentation. We hope that your questions were answered and that you feel ready to start thinking about your own health while caring for others. So some very simple and practical tips were provided, and I encourage you to make time for yourself. I saw this video on social media that mentioned 10 commandments, and I found it quite useful. And a couple of weeks ago, when I was overwhelmed with work and really needed to take some time for myself, I got that video just in time. So I thought it would be quite useful and fitting to share these 10 commandments, because they fit perfectly into our discussion this afternoon. It was called Coffee and Lipstick, so I'm not sure if you have seen it before. But the commandments are: thou shalt not be perfect or even try to be. Thou shalt not try to be all things to all people. Thou shalt sometimes leave things undone and don't feel guilty. Thou shalt not spread thyself too thinly. Thou shalt learn to say no as a complete sentence and mean it. Thou shalt schedule time for thyself. Thou shalt switch off and do nothing regularly. Thou shalt never feel guilty for doing nothing or for trying to de-stress. And thou shalt not be thy worst enemy, but be thy own best friend. So I think these are some great tips that whenever you need to take that time and you feel that you have so many things to do, you have so many outstanding tasks, you have to remember that it is important for you to schedule time for yourself. So as we come to the end of the session today, I really want to thank all the participants, all of you for being part of this, for the team, Dr. Othello for moderating the question and answer, Dr. Allen for summarizing and pointing out some key takeaway messages. But just to remind you that the recording for today's session will be uploaded to our PAHO Trinidad and Tobago Country Office website. But there are other resources that are available on the PAHO website, and we have many different PAHO offices. So it could be the country office of Trinidad and Tobago, or the country office in which you reside, or our sub-regional office in Barbados, or head office in Washington, D.C. So whichever of the PAHO website that you go on, you will be able to find useful information, the recordings from this webinars and previous webinars that were held, and other resources that may be useful to you. We also have information on our social media platform, so please check out PAHO on your social media platform. So this brings us to the end of this webinar, and we thank you all for joining us. Have a good afternoon and a great weekend, and we will keep you updated on future webinars. Thank you, over and out.